السلام عليكم ورحمة الله وبركاته. I am Amir Nasser, a student in grade 5 Al-Ahrar Nursing Institute. I will talk about Leopold Maneuvres, abdominal examination for pregnant women. Definition of Leopold Maneuvres are common and systematic way to determine the position of the fetus in the uterus. Leopold Maneuvres are performed late in pregnancy after uterus large enough to allow the presenting parts of the fetus of the woman. This method of abdominal examination is of low cost, easy to perform, and non-invasive. Objectives of Leopold Maneuvres: used to determine the duration of pregnancy. How to determine the duration of pregnancy? Ask the patient about the first day of the last menstrual period and calculate the duration of pregnancy. Objectives number 2 of Leopold Maneuvres: to determine the lie, to determine the presenting parting of the fetus, to determine the attitude, to determine the position of the fetus in the uterus, to determine engagement of the presenting parts of the fetus in the pelvis, to auscultate fetal heart rate. Steps of Leopold Maneuvres. Step number 1 called first maneuver, fundal grip. Answer the question: what is in the fundal? Head or breech? This is the most commonly are phallic or breech. Facing the woman's head. Place the tips of the fingers of both hands on the uterine fundus. When the fetal head is in the fundus, it will feel hard, smooth, globular, mobile, and palatable. When the fetal breech is in the fundus, it will feel soft, irregular, smooth, and less mobile. The lies commonly is longitudinal or transverse, but occupationally may be oblique. Step number 2 of Leopold Maneuvres called second maneuver, umbilical grip. Answer the question: where is the back? How to performing second maneuver? Facing the woman's head. Place your hand on either side of the abdomen. Steady the uterus with your hands of one side to determine the location of the back. The head will feel firm, smooth, convex, and resistant. The small parts, arms and legs will feel small, irregular, knobby, and may be actively or passively mobile. Third maneuver. Answer the question: what is the presenting part? It is the parts of the fetus that contacts with your fingers in vaginal examination, most commonly head or breech. How to performing third maneuver? Place your hands facing the woman's. Step number 1 of third maneuver, facing the woman's head. Place your hands, place the tips of one hand on the woman's abdomen just above the symphysis. Ask the patient to take a deep breath and let it out. As she exhales, send your fingers down slowly and around the presenting part. Note the contour, size, and consistency of the part. The head will feel hard, smooth, mobile if not engaged, immobile if engaged. The breech will feel soft and irregular. Fourth maneuver. Answer the question: where is the cephalic prominence? When the head is flexion, the forehead forms the cephalic prominence. When the head is extension, the occiput becomes the cephalic prominence. How to performing first maneuver? Facing the woman's feet. Gently move your hands down the sides of the abdomen towards the pelvic until the fingers encounter the cephalic prominence. This is the cephalic prominence. When the head is extension, cephalic prominence will be located in the same side as the back and will be the occiput. This maneuver can often cause some comfort to the woman. It may be different.